Your prostate might be trying to save your heart. I know that sounds backwards, but stick with me here because what I discovered in my practice completely changed how I approach men's health after 50. 3 months ago, a patient named Robert came to see me. 62 years old, frustrated with getting up 4 times a night to urinate, weak stream, you know the story. But here's what caught my attention during his intake. He mentioned his cardiologist had recently put him on blood pressure medication and was concerned about his cholesterol. Two separate doctors, treating two separate problems, right? Wrong. What if I told you that your enlarged prostate and your cardiovascular risk are actually two sides of the same coin? That the inflammation destroying your prostate health is the exact same process that's silently building plaque in your arteries? And more importantly, what if addressing one could dramatically improve the other? The connection between prostate health and heart disease is one of the most overlooked relationships in men's health. And frankly, it's costing lives. Because while you're focused on that weak stream and interrupted sleep, your cardiovascular system might be sending you warning signals that most men and even many doctors completely miss. Let me share what 15 years of functional medicine practice has taught me about this hidden connection, and why understanding it might be the key to protecting both your prostate and your heart for decades to come. The problem starts with what's happening inside your body right now. If you're over 50 and dealing with prostate symptoms, there's a 90% chance you also have some degree of cardiovascular dysfunction, whether you know it or not. The Cleveland Clinic published research showing that men with moderate to severe prostate symptoms have a 45% higher risk of cardiovascular events within the next decade. Think about that for a moment. Your prostate isn't just affecting your sleep and bathroom habits. It's potentially a canary in the coal mine for your heart health. But here's what most doctors don't explain to you. The same inflammatory cascade that's enlarging your prostate and creating those frustrating symptoms is also quietly damaging the delicate lining of your blood vessels. When your prostate becomes inflamed due to hormonal changes, particularly rising levels of DHT and declining testosterone, your body produces inflammatory cytokines like interleukin-6 and tumor necrosis factor alpha. These aren't just fancy medical terms. They're molecular messengers that travel throughout your bloodstream, causing inflammation wherever they land. And one of their favorite targets? The endothelium, which is the thin layer of cells lining your arteries. This chronic low-grade inflammation doesn't just make your prostate swell, it makes your arterial walls sticky, attracting cholesterol and other debris that eventually forms the plaques responsible for heart attacks and strokes. Meanwhile, the same hormonal imbalances affecting your prostate are also disrupting your body's ability to produce nitric oxide, the molecule responsible for keeping your blood vessels flexible and your blood pressure normal. Robert's story suddenly made perfect sense. His prostate symptoms weren't separate from his cardiovascular concerns. They were part of the same underlying process that had been building for years. The weak urinary stream, the frequent nighttime wake-ups, the rising blood pressure, the concerning cholesterol numbers, they were all connected by this web of inflammation and hormonal dysfunction. But here's the part that really frustrated me. He'd been to 3 different specialists over 2 years. A urologist who wanted to prescribe an alpha blocker for his prostate, a cardiologist focused solely on his blood pressure and cholesterol, an endocrinologist who barely looked at his testosterone levels because they were technically within normal range, even though they'd dropped 30% over the past 5 years. Nobody was looking at the bigger picture. Nobody was addressing the root cause driving both problems simultaneously. I'm Dr. Michael Stone, and I've spent the last 15 years practicing functional medicine with a focus on men's health optimization. What drew me to this approach wasn't just the science, though the research coming out of institutions like the NIH and functional medicine journals continues to validate what we see clinically every day. It was the frustration of watching conventional medicine treat symptoms in isolation, while missing the underlying connections that could transform a patient's entire health trajectory. My background combines traditional medical training with extensive education in functional medicine principles, nutritional biochemistry, and hormone optimization. But more importantly, I've worked with over 3,000 men dealing with prostate and cardiovascular health challenges, and what I've learned from their experiences has shaped everything I do in my practice. When I started connecting the dots between prostate health and cardiovascular disease, it wasn't just theoretical. I was seeing it play out in real time with my patients. Men who came to me for prostate issues but discovered their sleep quality improved, their energy increased, their blood pressure normalized, and their cholesterol profiles dramatically improved when we addressed the underlying inflammatory and hormonal imbalances comprehensively. The functional medicine approach isn't about replacing conventional care. It's about understanding that the human body is an interconnected system where everything influences everything else. Your prostate doesn't exist in isolation any more than your heart does. They're part of an intricate network of hormones, inflammatory pathways, vascular function, and metabolic processes that either support optimal health or contribute to dysfunction and disease. So what exactly is this connection, and why does it matter so much for your health after 50? Let me explain the mechanism that links your prostate and cardiovascular health, so you can understand why a targeted approach can address both simultaneously. It starts with understanding that both your prostate and your cardiovascular system depend heavily on optimal hormone balance, particularly testosterone, and healthy inflammatory responses. As men age, testosterone levels naturally decline, typically about 1 to 2% per year after age 30. But it's not just the decline in testosterone that creates problems. It's what happens to that testosterone in your body. An enzyme called 5-alpha reductase converts testosterone into dihydrotestosterone, or DHT. While DHT is important for maintaining masculine characteristics, when levels become excessive relative to free testosterone, it triggers prostate enlargement and inflammation. Here's where it gets interesting. The same enzyme pathways involved in DHT production also influence the production of inflammatory molecules called prostaglandins. Specifically, when DHT levels are high, your body increases production of prostaglandin E2, which is strongly pro-inflammatory. This prostaglandin doesn't just affect your prostate. It circulates throughout your body, promoting inflammation in your arterial walls, making them more susceptible to plaque formation and less responsive to nitric oxide signaling. Meanwhile, declining testosterone levels directly impact your cardiovascular health through multiple pathways. Testosterone is crucial for maintaining healthy endothelial function, which means your blood vessels stay flexible and responsive. It also helps regulate lipid metabolism, keeping your cholesterol profile balanced. When testosterone drops significantly, your HDL cholesterol often declines, while triglycerides and small particle LDL cholesterol increase, creating a lipid profile that strongly predicts cardiovascular events. But there's another layer to this connection that most people don't realize. Both prostate enlargement and cardiovascular disease are strongly linked to insulin resistance and metabolic dysfunction. The same dietary and lifestyle factors that drive insulin resistance, chronic inflammation, high insulin levels, elevated blood sugar, also promote both prostate growth and arterial plaque formation. Think of insulin resistance as the soil in which both prostate problems and heart disease grow. When your cells become resistant to insulin signals, your pancreas produces more insulin to compensate. These chronically elevated insulin levels promote inflammation throughout your body, stimulate DHT production, interfere with healthy testosterone metabolism, and accelerate the development of arterial plaque. This is why men with metabolic syndrome have both dramatically higher rates of prostate enlargement and significantly increased cardiovascular risk. The solution isn't to treat each condition separately. It's to address the underlying metabolic and hormonal imbalances that drive both. When Robert and I started working together, we didn't just focus on his prostate symptoms or his cardiovascular risk factors in isolation. We developed a comprehensive protocol designed to optimize his hormone balance, reduce systemic inflammation, improve insulin sensitivity, and support both prostate and cardiovascular health simultaneously. The foundation of this approach involves targeted nutritional strategies that address the specific inflammatory pathways linking prostate and heart health. We started with omega-3 fatty acids, specifically EPA and DHA, in a 2-to-1 ratio, at therapeutic doses of 3 grams daily. These essential fats directly compete with arachidonic acid in the production of inflammatory prostaglandins, shifting the balance toward anti-inflammatory compounds that benefit both prostate and cardiovascular health. Next, we added specific polyphenol compounds that research shows can modulate both DHT production and endothelial function. Quercetin, at 500 milligrams twice daily, inhibits 5-alpha reductase, while also supporting nitric oxide production and reducing arterial inflammation. Green tea extract, standardized to 90% polyphenols, provides EGCG that helps regulate hormone metabolism and supports healthy cholesterol levels. But perhaps most importantly, we addressed his insulin sensitivity through a targeted approach combining specific nutrients with strategic dietary modifications. Chromium picolinate, berberine, and alpha-lipoic acid work synergistically to improve insulin signaling, reduce inflammatory markers, and support healthy testosterone metabolism. The dietary component focused on eliminating refined sugars and processed foods that drive insulin resistance, while emphasizing anti-inflammatory whole foods rich in fiber, healthy fats, and phytonutrients. One thing I started recommending to patients like Robert is tracking their response to these interventions daily. There's actually an app I use with them, I'll leave the link in the pinned comment, that helps monitor both prostate symptoms and cardiovascular markers like blood pressure and energy levels, adjusting the protocol based on their individual response patterns. This kind of personalized tracking is crucial because what works optimally for one person might need fine-tuning for another. The goal is to identify the specific combination of interventions that produces the best results for both prostate and heart health in each individual. Beyond supplementation, we implemented specific lifestyle modifications that research shows can dramatically improve both prostate and cardiovascular outcomes. High-intensity interval training 3 times per week not only improves insulin sensitivity and reduces inflammation, but also naturally boosts testosterone production while supporting healthy blood pressure and cholesterol levels. We also incorporated specific stress management techniques, particularly since chronic stress elevates cortisol levels that interfere with testosterone production and promote both prostate inflammation and cardiovascular dysfunction. The results were remarkable, and they align perfectly with what research institutions like the NIH are discovering about the interconnected nature of men's health challenges. Within 6 weeks, Robert's nighttime urination decreased from 4 times per night to once or twice. His urinary stream strength improved noticeably. But here's what really validated our approach. His blood pressure, which had been consistently elevated despite medication, normalized to the point where his cardiologist was able to reduce his dosage. His total cholesterol dropped 40 points, but more importantly, his HDL increased, while his triglycerides decreased, indicating improved overall cardiovascular health. A follow-up inflammatory marker panel showed his C-reactive protein had dropped from 3.2 to 1.1, indicating significantly reduced systemic inflammation. This wasn't coincidence. When you address the underlying metabolic and hormonal imbalances driving both prostate and cardiovascular dysfunction, improvements in both areas are the expected outcome, not a surprise. The Cleveland Clinic has published similar findings in their men's health research, showing that comprehensive approaches addressing inflammation and hormone optimization can produce improvements in both prostate symptoms and cardiovascular risk factors simultaneously. But Robert's case also highlighted something else important. The timeline for improvement varies between prostate and cardiovascular benefits. Prostate symptoms often improve within the first month, as inflammation decreases and hormone balance improves. Cardiovascular improvements, while they begin immediately at the cellular level, often take 2 to 3 months to become measurable in standard tests like blood pressure and cholesterol panels. This is why tracking daily symptoms and energy levels becomes so valuable. You can see the improvements happening before they show up in lab work, which helps maintain motivation and allows for protocol adjustments that optimize results. I've now worked with hundreds of men using this integrated approach, and the pattern is remarkably consistent. Men who address both prostate and cardiovascular health through comprehensive metabolic and hormonal optimization typically see improvements in both areas, often exceeding what they achieve when treating each condition separately. There's also emerging research suggesting that men who take a proactive approach to addressing these interconnected health challenges in their 50s and 60s dramatically reduce their risk of more serious complications in their 70s and 80s. A 2024 study published in functional medicine journals followed men for 15 years and found that those who addressed both prostate and cardiovascular health comprehensively had 60% lower rates of major cardiovascular events and 70% lower rates of requiring prostate surgery compared to men who received conventional treatment for each condition separately. Now let me share something that might change how you think about prevention versus intervention. Most men don't realize that the inflammatory and hormonal processes linking prostate and heart health begin decades before symptoms appear. The same insulin resistance that will eventually contribute to prostate enlargement is already affecting your testosterone metabolism and arterial health in your 40s, even if you feel perfectly fine. This is why I tell my patients that optimal men's health isn't about waiting until problems develop and then treating them. It's about understanding these connections and taking action to optimize the underlying processes before dysfunction becomes symptomatic. The great news is that the interventions that prevent both prostate and cardiovascular problems are essentially the same as those that treat existing symptoms. Whether you're dealing with current challenges or want to prevent future ones, the approach centers on optimizing insulin sensitivity, reducing chronic inflammation, supporting healthy hormone metabolism, and maintaining excellent cardiovascular function. There are also some advanced strategies that can accelerate results for men who want to be more aggressive in their approach. Intermittent fasting, when done correctly, can dramatically improve insulin sensitivity while naturally boosting testosterone and growth hormone production. Time-restricted eating windows, typically eating within an 8 to 10 hour period daily, give your body extended periods to repair inflammatory damage and optimize hormone production. Cold exposure therapy, whether through cold showers, ice baths, or cryotherapy, activates pathways that reduce inflammation while stimulating the production of noradrenaline and other compounds that support both prostate and cardiovascular health. Even something as simple as red light therapy, used for 15 to 20 minutes daily, can improve cellular energy production and reduce inflammatory markers throughout the body. The key is understanding that small, consistent improvements in multiple areas compound over time to produce dramatic changes in overall health. You don't need to overhaul your entire life overnight. You need to consistently implement strategies that address the root causes driving both prostate and cardiovascular dysfunction. I also want to address a common concern I hear from men who are already taking medications for either prostate or cardiovascular issues. This functional medicine approach isn't about replacing your current medical care. It's about optimizing the underlying physiology so that your body responds better to whatever treatments you're using. Many of my patients find that as their overall health improves, they're able to work with their physicians to reduce medication dosages, or in some cases eliminate certain medications entirely. But this should always be done under medical supervision with regular monitoring. There are 3 daily practices that can make an immediate difference in both your prostate and cardiovascular health, starting today. First, every morning spend 10 minutes doing deep breathing exercises focused on extending your exhale longer than your inhale. This simple practice activates your parasympathetic nervous system, reducing cortisol levels that interfere with testosterone production, while simultaneously lowering blood pressure and improving heart rate variability. The 4-7-8 breathing pattern works particularly well. Inhale for 4 counts, hold for 7, exhale for 8, repeat for 10 cycles. Second, add a 15-minute walk after every meal, particularly dinner. Post-meal walking dramatically improves insulin sensitivity, helping your body process glucose more efficiently and reducing the inflammatory spikes that contribute to both prostate inflammation and arterial damage. This simple habit can lower post-meal blood sugar by 30 to 40% and improve insulin sensitivity for hours afterward. Third, optimize your sleep environment for deeper, more restorative sleep. Poor sleep quality directly interferes with testosterone production and increases inflammatory markers that affect both prostate and cardiovascular health. Keep your bedroom cool, ideally between 65 and 68 degrees. Eliminate all light sources and stop eating at least 3 hours before bed to allow your body to enter deep repair modes during sleep. These might seem like small changes, but they address fundamental physiological processes that influence both prostate and heart health. When you consistently support your body's natural repair and optimization mechanisms, you create an environment where both systems can function optimally. I also recommend having a specific conversation with your doctor at your next appointment. Ask about your inflammatory markers, particularly C-reactive protein and homocysteine levels. Request a comprehensive hormone panel that includes not just total testosterone, but also free testosterone, DHT, and estradiol levels. Get a detailed lipid panel that measures particle sizes, not just total cholesterol numbers. Understanding these biomarkers gives you and your healthcare team specific targets to work toward and allows you to track the effectiveness of any interventions you implement. Remember, optimal health isn't about achieving perfect numbers. It's about optimizing the underlying processes that support long-term vitality and function. Robert's transformation didn't happen overnight, but it was remarkable to witness. 6 months after we started working together, he told me that he felt better at 62 than he had at 55. His prostate symptoms had essentially resolved. He was sleeping through the night consistently. His energy levels were higher and more stable throughout the day. His cardiovascular risk factors had improved to the point where his cardiologist described his progress as exceptional. But perhaps most importantly, he felt confident and empowered about his health trajectory, rather than worried about inevitable decline. This is what's possible when you understand and address the connections between different aspects of your health, rather than treating symptoms in isolation. Your prostate and your heart are trying to tell you the same story about what's happening inside your body. When you listen to that story and respond comprehensively, the results often exceed what anyone expects from addressing each issue separately. If you found this valuable, subscribe. I share new research and evidence-based protocols every week that can help you optimize your health for the long term. And remember, the app I mentioned for tracking your daily response to these protocols is linked in the pinned comment below. Understanding these connections is the first step. Taking consistent action based on that understanding is what transforms your health trajectory for decades to come.